We've got Tristan here. A pole around 200 kilograms has fallen onto his head. It's then crushed his right hand.
Nice and slow breathing, mate.
I don't know if the huge weight has completely amputated his hand.
I'm just going to gently cut your bandage off. It could be anything going on under this glove.
You were by my side, came to my aid. Look inside my eyes and help me try to ease the pain. You're my lifeline, tell me it's gonna be right. You're my lifeline, reach out your hand, take mine.
Very worried for you, my friend.
The bone's been smashed to bits.
He's actually stopped breathing.
Help me, please save me right now.
Without intervention, he's likely to die.
That's better.
I need you to save me now.
I'm so tired. Because I've been shoveling gravel all weekend. It's hard work.
I've mowed, put out 2 tonne of mulch on the garden.
Oh, because you've got the big party.
In the middle of a busy shift, emergency doctor Jonathan Papson is giving his longtime colleague, emergency doctor Emma West, some important advice.
What time do you want people to go? Let's work backwards. You want people out there by 8:30, so you can go to bed.
Jonathan and I have been friends for about maybe 10 years. He's fairly free and easy with his advice. He likes to direct me one direction, I tend to go the other, but that's fine, that's how we work. He's fairly forthcoming with how I should plan things in particular parties.
So what time's the food start?
Probably 4:30.
Why don't you get the food like at a good time, like 6 o'clock or something?
The party planning is cut short with another trauma on the way.
Receiving, go ahead, please.
We're coming to you with a patient. He's a construction worker. He's had a 200-kilogram beam fall onto his head and then landed on his right hand. He still has the glove on at the moment, but it looks like there's some fat and things like that protruding through the glove, and we'll be there in 15 minutes.
Dr. Emma takes the case and asks Dr. Jonathan to assist.
They can't get the glove off.
No, I reckon...
That's weird.
Oh, the glove might have gone through the finger, the hand.
It might be they're worried if they pull the glove off, they pull his hand off.
Possibly.
That's what they're worried about.
Okay.
That's bad.
Worksite injuries always make me feel very, very uncomfortable. They can lead to catastrophic injuries, and this man has had a huge amount of force pass onto his body. So although I'm running through all the different life-threatening injuries that he may have, I'm well aware that the main focus for him will be his ability to use his hands and continue to work. So Gunnar, born in 87, so young.
Dr. Emma immediately briefs her team.
200-kilogram beam versus head, then shoulder, then hand, with a nasty hand injury.
It's mangled.
Yeah. Wearing a hard hat, but clearly could have a head injury, may have a torso or chest injury, but we're most worried about the hand.
What I'm worried about is getting the glove off. It's mangled, so it's all going to be painful and bad.
Paramedics have arrived with Tristan, a 36-year-old construction worker who's been given the green whistle, a powerful painkiller.
Thank you. This is Tristan. Gloves on, yeah. Tristan, we'll get you across onto the other bed, and then we'll have a look at your hand, okay?
I'm about 116 kegs, guys, so...
That's fine, they're strong people.
Well, they're moving. On 3, 1, 2, 3.
So what's happened is a pole around 200 kilograms has fallen onto his head. The hard hat's deflected the pole to the right side. It's then struck his right shoulder, then down onto his right hand, which was resting on something else, crushed his right hand.
Okay.
Tristan was dismantling a gantry on a bridge when the accident happened.
You blacked out?
No.
This is a really nasty accident. I'm worried about a head injury, a chest injury, but immediately in front of me is a potentially limb-threatening injury, his hand. I don't know what's under the glove. I don't know if the huge weight on his hand has stopped blood supply, crushed nerves, broken bones, or completely amputated his hand.
I'm just going to gently cut your bandage off.
Dr. Jonathan starts the delicate procedure of uncovering the wound.
Oh. I'm really worried about how bad his injury is, and I'm really worried that I don't make the injury worse by taking the glove off. But I need to see what the damage is. I'm a bit worried this whole thing's going to come off.
Emergency Registrar Dr. Tristan Harding is in the middle of a busy shift. And it's about to get busier with another workplace accident on the way.
Coming to you with a year-old man, and had a 4-metre fall landing flat on his back. And he's like primarily pain in his left wrist, left side of his wrist and chest, and lower back. And severe and about 5 minutes.
Stevie.
ED doctor's coming now.
Any fall more than 3 metres is considered major trauma, so he could have a serious spinal injury or head injury. Any time you land with such force to the ground, there is a risk of internal injuries, so we need to be prepared for everything.
Paramedics are bringing in 60-year-old Vlas, who's in a lot of pain after falling from a roof.
Oh, shit. Hello, my friend.
Just try these all the way across. Ready, set, go. What is your name?
How you going? Tristan, nice to meet you.
Tell me in your own words.
Stand up on the rivers. Sun past the long continue up to me. Grabbed it and found backwards. And for about a second or two, it was like, shit, what happened? I realised I found, and I thought, oh, what am I like?
So pain can be trauma bloods, the wrist x-ray.
And so pain in your neck and pelvis.
Not pelvis, lower back.
Just your lower back.
Whoa.
Vlas has an obvious wrist injury and he's in a lot of pain. So first priority is to get some x-rays.
Can you take a big breath in, breathe in, hold your breath.
It looks like the top of the bone is broken off and it's in the wrong spot. When we look at the x-ray, you can see Vlas has broken the end of the radius off. It's so badly broken, we're going to need to realign the bones here in emergency. But before I do that, I need to make sure his spine's okay. Given he's landed flat on his back, he could have fractures to any part of his spine.
So Vlas, just do the x-rays then if you've got a broken wrist.
So we'll roll you across onto your right, and that way we can protect your wrist at the same time.
It's the first time I've broken a bone.
1, 2, 3. Okay, you stay nice and still. Megan's gonna push on your back, and every time she touches, just say yes or no as to whether it's sore, okay?
Yes or no?
No.
Yes or no?
No.
Keep going.
Yes.
Bit sore down through here?
Yep.
Yep.
Grimacing.
Yep.
Yep.
Happy to go down? On 3, 1, 2, 3. We'll just do your neck next. So you keep nice and still for us.
Sore it all through here?
No.
Yes or no?
Yes.
Yes or no?
Yes. Yes.
Vlas is sore in lots of spots throughout his entire spine, from his neck right the way down to his hips. Given the force and the distance that Vlas has fallen, he could have a serious spinal injury, which could impact on his nerves and ultimately could leave him paralysed. He needs to get a scan immediately. If you've got any pain at all, let us know.
I just can't get the glove off. I need some little scissors, you know, like just normal surgical scissors? Yeah.
Dr. Jonathan is trying to remove a work glove embedded in construction worker Tristan's smashed hand.
Sorry.
After a 200-kilogram pole fell on him.
Emma, I can't get it off. You've got to use the right tool for the right job. And the scissors I've got are too big. We need something a little bit more delicate because it's becoming a fine operation to try and cut this glove off. Wow, that's tricky. It could be anything going on under this glove. Is it a limb-threatening injury? Is it a hand-threatening injury, which means that he might lose fingers or thumb? Is that what's going on? We've got to get it off. But you need to be careful that you don't make it worse.
Before I go like that.
Yeah. So just careful,
So we're
careful.
just giving you some more pain relief as well, but if we need to, we can numb your finger.
Tristan's glove may be the only thing holding his thumb in place.
Nice and slow breathing, mate.
Sorry, mate. Here we go, here we go. It's coming. Beautiful. I was actually worried your whole thumb was going to come off. He's got a nasty injury. Thankfully, he doesn't have an amputation, but it's a real mess in there. There's skin that's been torn from between the thumb and the first finger. There could be tendon damage, nerve damage, and he's probably got some broken bones there. So he's cut into the base of the thumb joint, Emma.
Can I actually have a look at it? Jesus Christ.
What about your feeling? Can you feel me touching?
Yep.
You've got normal feeling, okay. Can you give me a thumbs up? Okay. It's really encouraging that he can give me a thumbs up and he has some movement of his thumb. But we're always worried about infection in injuries like this. You need to get all that extraneous junk out of there. There might be bits of glove stuck in his wound. There might be bits of grit, bits of dirt. We're just going to wash this out, all right? So we're going to pour a lot of saline on it, probably sting a bit, all right? Sure. Yeah.
This is not the first time Tristan has been in emergency.
I was actually here at 18 when I had a pretty bad car accident.
Oh, did you?
The help was excellent then. It's good to see it hasn't changed.
Oh, that's all right.
How much analgesia has he had? I think we should give him some more before we wash this, because it's going to hurt. I would like to be able to tell Tristan that his thumb's going to be okay, but until we have a proper look and the surgeons have a look and they can repair things, you can't really say, is his thumb going to work properly again? Will he not be able to work? We just don't know.
We'll go across in one go, okay? So 1, 3, 1, 2, 3. Perfect.
Oh, it's my wrist.
Yeah, that's okay. You hold it nice and still.
Dr. Tristan scanning 60-year-old Vlas for neck and spinal injuries after he fell 4 metres from a roof onto his back.
Most important thing is you stay really still, okay? I'm sure the last thing on Vlas's mind when he woke up this morning was ending up in an emergency department with a potentially life-changing injury. I really hope for Vlas's sake that the scan doesn't show anything sinister.
Breathe in and hold your breath.
Vlas's wife Maria and daughter Stacey have rushed into the ED and are anxiously waiting to see him.
We met through friends 37 years ago. He's a good man. He's very sensitive, loves his kids.
1, 2, 3. Perfect. Thanks, everyone.
He's very gentle, very caring person. I'm scared for him.
Yeah. How much do you weigh?
73.
73.
As Dr. Tristan waits for the CT results, he prepares to realign Vlas's badly broken wrist.
So we're going to give you 2 medications which will make you feel a little bit drowsy
20 mils.
and put you a little bit to sleep while we fix your wrist. When you wake up, it'll be in a cast, okay? This procedure is particularly painful, given the extent of the injury, so it's important to make sure Vlas is asleep so that he won't feel this at all.
40 of chest
So there's 20 of propofol.
20 of propofol.
I'm falling asleep.
Oh, good. See if you can feel me touching his wrist. Beautiful. That's a good, and title's still good.
With Vlas fully sedated, Dr. Tristan begins to pull his wrist back into place.
Do you want to hop in that top so you can get the counter traction? Just going to gently pull.
This can be a really confronting procedure. It is very much a tug of war with a limb. But you don't want to apply too much force because it is still a bone and it has the potential to come out of the skin.
Dr. Tristan is struggling to get the wrist back into position.
Another 10 of propofol.
This is tricky because the bone's been broken off and in the wrong spot for a couple of hours. All the muscles have tensed around it. If I don't get these bones back in the right spot, this could impact on Vlas's ability to use his hand.
You're all right, darling.
I want a non-stick dressing on there, and then we're going to wrap it up.
In Trauma Room 2, Dr. Jonathan is about to start cleaning out construction worker Tristan's hand after it was sliced open by a 200 kilogram metal pole.
Just wash all the bad stuff out.
All right, my dude. Gonna give you some antibiotics as well, mate.
So the idea is that we just create a non-sticky surface so that when all the blood dries, all the skin doesn't get pulled off. How's the pain situation?
So bad, just when you put pressure on it.
Sorry, yeah.
Let us know, Jonathan, if you want more fence.
Yes, please. Maybe another 25.
Another 25?
Emergency nurse Gunnar Pedersen is happy to distract Tristan.
Who's your tattoo artist?
The one on my left, I had back when I was in Canada. I lived in Canada for 10 years.
All right. Today is probably one of the scariest days that Tristan has ever had. And honestly, I know a little bit how that feels because I myself have been a patient rushed into a hospital. I was a bit scared and uncertain what was going to happen next. But when I came to that hospital, people talked to me as a person. People asked me about me and my story. And I think that experience made me a better nurse.
I was in Toronto for about 6 or so years.
Oh, Toronto, all right, yeah.
So do you want to just hold him like that?
It's fantastic.
Okay.
Just
You're talking travel.
Yeah, he lived in Canada.
What did you do there?
I had my own construction company.
Oh, really?
Yeah. I'm a carpenter by trade, but operating now as a rigger, dogman, crane operator.
Okay.
Yep.
So you need your thumb to work properly.
Yeah.
And are you right-handed?
Yes.
Yep.
So that's not ideal.
Now, just make it comfortable for you, Tristan.
With Tristan's hand now stable, Dr. Emma shifts her focus to other possible injuries.
Was it a metal or wooden pole?
Steel.
Oh, God. So you'll have a scan of your head and neck and we'll get an x-ray of your hand. I know Tristan has a really badly injured hand, but really he could still have other injuries, like a head injury or a chest injury or internal bleeding. He's had a huge force pass through his body, so it will be a miracle if he's not injured, but only the CT scan will really tell us.
Right, to the scanner.
I still feel the fragment.
Dr. Tristan is trying to pull the bones in Vlas's badly fractured wrist back into place after he fell 4 metres from a roof. To avoid further damage, it's crucial the wrist is put back into the right position.
You happy, Joyce?
Breathing away.
Still got a step there. But...
Finally, Vlas's bones are back in place.
Feels better. Looks better. There's a very slight step there, but it's pretty good.
Yeah.
That was a tough one, but we finally got the bone back in the right spot. I'm now going to wrap Vlas's wrist up in plaster. That's going to protect his wrist from further injury and reduce his pain while waiting for the CT results to come back.
Vlas, open your eyes there for us. You're all finished. How's that? Like a trip. A good one or a bad one? Very good. That's what we like to hear.
With Vlas now awake, his wife Maria and daughter Stacey can finally see the much-loved 60-year-old.
Mom's here.
Hey, how are you? Do you know what your injuries are? Have they told you?
I had a broken wrist.
Yeah.
Vlas's CT results are back. Dr. Tristan now has the information he needs.
The brain looks pretty good. I can't see any broken bones in the neck either. So just looking through Vlas's scan of his spine, oh wow.
Suddenly, Dr. Tristan sees something alarming.
You can see at the bottom, all these ones look like squares, and this one doesn't because it's broken.
And there's an even bigger problem.
He's got a really nasty fracture here at L2, and that's what I call a burst fracture, where you can see the bone has shattered into lots of pieces. This is about as bad a spinal fracture as I've ever seen. Vlas has fractured his back in not one, but 2 places. The concern about this burst fracture is that one of the fragments of bone could impact on his spinal cord, and that could leave Vlas paralysed. Hey, Vlas. So it's going to go through all your results we've got so far.
Dr. Tristan must now break the devastating news to Vlas.
Your neck and head look okay, but lower down your spine, it looks like you've got a couple of broken bones in the spine itself. One of the breaks is quite bad. It's called a burst fracture. We're going to get the orthopaedic doctors to come down and work out what to do. I'll come back soon, okay?
Thanks.
Thank you. No worries.
My heart breaks. I'm devastated. Kills me.
Hey, there's worse things happening in this world. I'm okay.
Yeah, I'll do it.
Can't move too much.
We'll get the orthopaedic doctors to come down and make a plan with Flass about how they're going to fix his wrist and manage his spinal injuries.
I'll be all right.
There's a couple of options for Flass. He might need an operation, he might need to wear a brace, but it's a serious injury. This is going to be a slow and difficult recovery.
Here we go. It's a major trauma coming from a stall, a motor vehicle into a pole, into a wall.
Something got stuck in the
Coming by a chopper.
Emergency assistants Leo Quinones and Ethan Lynch head up to meet the air ambulance that's bringing in the badly injured man from over 200 kilometres away.
We're trauma assistants, so our job is to facilitate the nurses and doctors with patient flow and extracting the patient from the helicopter and go out to make sure everything's operational. It's a big responsibility.
So basically, when you hear the helicopter land, we've got about 8 minutes.
Okay.
With the chopper arriving, emergency registrar Dr. Asia Khalid quickly gathers her team.
Shall we just do a little huddle? So it's a trauma alert.
Today, the pressure is on for Dr. Asia, who's team leader.
In terms of getting things ready, so MEP, we'll get some ketamine because he's on a ketamine infusion.
Sure.
We have a young gentleman that was involved in a motor vehicle accident. They're concerned that he may have broken his pelvis and he's also broken one of his thigh bones. You can get a significant amount of bleeding and lose a large volume of blood from a pelvic fracture and from a thigh bone fracture. It's really an alarming injury.
Paramedics arrive with 35-year-old mine worker Lee, who's in excruciating pain after smashing his car into a concrete wall.
Terry, do you want to do the EFAST then? If you put lead on and then do the EFAST?
Sure, I'll hang tight.
Sounds good.
Oh, yes.
This is Lee.
Oh, this shit's real.
Go. Ready, set, go.
Lee, my name's Asia, I'm one of the doctors.
Hello.
I'm part of the team looking after you. We'll just take handover whenever you're ready.
Lee's a 35-year-old driver and solo occupant of a 1992 Ford Falcon. No airbags are fitted. He's hit the accelerator as normal and the accelerator's become stuck and he's driven forward head-on into a concrete wall at a roundabout. Seatbelt was worn, head strike to the steering wheel.
Okay.
Oh.
Car enthusiast Lee has spent the last year and a half restoring his beloved 1992 Ford Falcon. And today was its first test drive.
He's got a right-sided possible mid-shaft femur fracture.
We'll put an ultrasound on you, okay, buddy? It's going to feel really cold.
He's got quite a lot of swelling, a significant leg shortening on that right side, and a potential pelvis as he's complaining of a lot of groin pain. He's got a SAM splint in situ.
To protect Lee's pelvis in case it has a fracture, a special binder has been fitted to hold it in place and prevent any bleeding.
Sharp scratch, mate. Okay. 3, 2, 1.
Management-wise, he's had a lot of analgesia. He's had phenterane. He's also on a fentanyl infusion and a ketamine infusion.
Okay, perfect.
I'm really quite concerned. With an injury as severe as Lee has, he's going to be in excruciating amount of pain. And because Lee crashed a car that is really quite old and doesn't have any of the protection that cars have these days, he would have absorbed more of the force from this crash. So he's at more risk of having bleeding, having chest injuries, pelvic injuries, and of course his thigh that we can see is injured.
Terry, how are you going with your EFAST?
Emergency Registrar Dr. Terry Kane is quickly checking for any signs of internal injury.
Right upper quadrant, left upper quadrant spine. I think there might be some pre-total fluids in the bladder. Just behind the bladder, maybe.
I see the top of his tummy is actually okay, but the bottom, there might be some fluid there. Fluid in the tummy during a trauma is always assumed to be blood, which is a bad sign. We know that he's got a broken leg, and if his leg is injured, his pelvis might be injured too. If there are broken bones there, you can bleed liters into your pelvis. That can be life-threatening.
The next step is just to make sure we've got adequate access, and then we'll get x-rays and aim to get to CT.
If Lee has any internal bleeding, his life could be at risk.
You're happy for X-ray?
Yeah, if you don't have lead, can you step out, please?
I'm really quite worried about Lee and all the injuries he might have. This is definitely an emergency.
Well, if we get some scans right now, we're going to make sure you're all right, okay? I'm really scared.
I'll be curious to see what's happening there.
Yeah.
Should have seen his thumb.
Dr. Emma has ordered scans for construction worker Tristan, who may lose the use of his right hand after a 200-kilogram pole hit him on his hard hat before smashing onto his hand.
All right, so we can see and hear you all the time. Just call out if you need anything, all right?
Worries.
The best case scenario for Tristan is that he doesn't have a head injury, and that's why we're doing the CT scan, to hopefully rule it out. But it just seems implausible that you can have a 200-kilo pole land on you and come out uninjured. So if there's an injury there, we need to know about it.
All right. Awesome.
As Tristan arrives back to the ED, Dr. Emma has the results.
So far, so good for Tristan regarding his scans of his head and neck. They appear normal, which is great because, you know, a 200-kilogram pole hitting your head is an incredibly large force. So fabulous for him. Oh, ouch.
But Tristan's hand is in bad shape.
So this little bone's okay, but in the middle here, this is broken and sort of snapped in half and displaced. So there's also possibly tendons, vessels, nerves in there that are damaged. There's also a big cut in and around here and a big cut in and around here and a broken bone. That's at risk of infection. Aha. Looks like Tristan's had an operation before. Tristan, have you broken your finger before?
Yeah.
How did you do that?
Many bones.
Have you? I just saw that you've got some metal in your hand on that.
Yeah. Boxer's fracture.
Yes.
Scaphoid.
Yeah.
Right clavicle, sternum.
Oh.
Got a plate and 8 screws in there.
Okay.
Just call me Robocop.
I will. I'll get you some more pain relief.
No worries.
Tristan will need to be admitted to hospital. The plastic surgeons will open the wound, clean out and identify other injuries, nerve injury, vessel injury, muscle injury, and begin the repair process of Tristan's thumb. The best outcome would be that Tristan has full function of his hand and that he's back able to work as soon as possible. But I do think this injury could be life-changing for him.
So we're going to get an x-ray of the femur, and then we're going to go to CT.
In Trauma Bay 1, Dr. Asia is x-raying 35-year-old Lee's badly broken leg.
Oh. Oh, we'll go on top of that in just a second, okay?
He's in extreme pain after crashing his restored 1992 Ford Falcon on its first test drive.
All right, buddy. Let's get into x-rays, okay?
Until Lee's partner Jess arrives from their home 3 hours away, he's having to face this trauma alone.
Where does it hurt right now? Well, back my femur.
If I was in the situation, I'd be terrified.
X-ray.
You're in so much pain, you don't know what's going on. So he has all the reasons to be terrified, but we have to try to keep him calm at the same time.
Oh, okay. That is very significant.
The X-ray gives Dr. Asia a clear picture of Lee's shocking leg break.
It's pretty severe. He's broken the big bone that makes up his thigh. This is a really serious break to his thigh bone. It's broken in multiple areas and it's completely out of place.
Can you feel me touching here?
Yeah.
I'm concerned about bleeding, and of course it's going to be really, really painful.
Oh, that is right off.
Lee, how's your pain?
Pretty bad.
Pretty bad.
Yeah.
Okay. Then we need to give you some more pain relief, okay?
All right.
Because we're going to move from this room to go to the CT scanner where we can have a look at what injuries you have.
Yeah, no worries.
So we'll go with that fentanyl for pain, yellow bag med pack, and boluses of analgesia. I think we're going.
There is a potential that Lee can deteriorate really quickly. It's important that we take all the things that we might need. We take blood in case he's bleeding internally, and we need to give him a transfusion urgently.
All right, so on 3, 1, 2, 3.
Bit of a dip, ready?
Sorry, mate. Deep breath, deep breath. That pain relief's going to kick in, okay?
Please breathe in and hold your breath.
I'm concerned that he might be bleeding internally. I'm concerned that he may have a brain injury because he hit his head with his thigh bone. I really want to make sure that the blood supply is not compromised, because the tissue can be starved of oxygen and become damaged, and in really the worst case scenario, you might need to have an amputation. There is a real risk that Lee has life-changing injuries from his crash today.
Let me know if you see anything. Yeah. Thank you.
My leg is fucking killing me.
I know.
In Trauma 1, car enthusiast Lee has a horrendous break in his leg after crashing his car into a cement wall.
Do you need more pain medication?
Yeah, I do. Yep.
You're doing very well.
Dr. Asia needs to get his extreme pain under control while she waits for CT results.
Oh.
I'm just going to give him a 20 bolus of ketamine.
Lee is in a lot of pain, and what I want to do is give him a nerve block, which gives him pain relief exactly where he needs it, so in his thigh bone.
If you've got no injuries to your pelvis, we can take this off.
But until I know that the CT confirms that Lee doesn't have a pelvic fracture or pelvic injury, I can't remove the binder and give Lee the nerve block.
Lee's CT results are finally through.
Okay. So there's nothing striking on the CT.
Lee has a few rib fractures and a small break in his spine, but crucially, his brain looks okay. He doesn't have any bleeding in his chest. He doesn't have any bleeding in his abdomen and his tummy. And importantly, he doesn't have any pelvic injuries. So we can take this pelvic binder off and put the nerve block in.
Let's take this off. All right, so you're just going to feel a sharp scratch if they give you the local anesthetic. Sorry.
Nerve blocks take about 15 minutes to kick in. Patients are really grateful for having them because it just targets the pain relief where they need it.
Hi, am I right to come in? I'm his partner.
After dropping their 2-year-old off with grandparents, Lee's partner Jess finally arrives.
Yeah, break so much. Pretty bad.
I know. Guess what? I think it's time for an upgrade. Let's do that, eh?
Lee has a big operation ahead of him to fix his leg. With an injury like this, it can take many months to get back to the position that Lee was before he had his crash. He won't be able to put any weight on that leg for at least 8 weeks, potentially more depending on how the operation goes and how he heals. And after that, he'll need physio and continued rehab. So it's a long road of recovery for him ahead.
During his shift, Paul Casey works as a diligent and caring emergency nurse practitioner. But after hours, he can be found rocking it out with his hospital band.
My two main loves are music and sport. I sing in a band with some of the boys from the ED. We're called the Code Grey. I love it. It's something completely different from what we do normally.
Back at his day job,
It's like blocked.
Nurse practitioner Paul and emergency doctor Jana Alexander are discussing a patient they've just examined and the ear pain she's suffering.
You can sort of see something over and then you can see the drum sort of behind it.
The patient is 31-year-old Irina, a mum of 3 and PhD student originally from Moldova.
It's very light to be waxed.
Rena's come into ED because she's got a 2-day history of pain to her right ear. I've had a look inside her ear and I can see that there's something there, but I'm not quite sure what it is. You've got something in there.
I had like a very bad pain here in my ear. It is hard to hear, so I come to the emergency.
As Nurse Paul prepares to investigate further, Irina asks him a question that could explain the earache.
Do you think it's because of my teeth or what?
Irina's told me that 2 days ago she had root canal surgery to the same side of her face and she was concerned that the pain may be related to that. If the pain is related to a root canal, it could be referred pain going up to her ear.
Yesterday, I added some drops, and after that I put like the wool.
Oh, so you better cotton wool in there, yeah.
Yes.
To try and relieve the ear pain herself, Irina has been using over-the-counter ear drops.
I remember from yesterday I put the
Cotton wool?
Yeah. I put it like after I
had the pain.
Dr. Jana needs to get the cotton wool out to see what's wrong with Irina's ear.
I think it would be good to remove it so we can examine the ear properly because we can't see your eardrum because of the cotton wool.
So do you put one of the little things in and then put the suction
Yeah,
through
so we
it?
need to get a bigger one of these.
Okay.
Nurse Paul and Dr. Jana plan to remove the cotton wool using a small suction tool.
I'm just going to pop some of this jelly into your ear. Okay. Okay, that's all in there now.
Nurse Paul can now begin the delicate procedure of trying to suck out the cotton wool.
Oh, I can see it. Maybe I need a bit more suction.
But the suction is not working. The cotton wool is still stuck.
Oh, I can see it.
Nurse practitioner Paul is struggling to remove cotton wool that's stuck in 31-year-old Irina's ear.
Maybe I need a bit more suction.
It's urgent it's removed, so he's able to see Irina's eardrum and can work out what's causing her pain. But it's not coming out.
Can I have a look up to the headphone?
Yeah.
I'll just have a quick peek.
Okay.
Right, Irina, I'm just going to have a little look, okay?
Extracting anything from the ear, it's a very sensitive area with lots of nerve endings. If I were to push it in too far, it could damage her eardrum, which would affect her hearing.
You okay? It's quite stuck in there. Yeah.
Oh my.
Sorry, darling.
Dr. Jana is also having no success with the suction tool.
It's very impacted.
Infected?
No, impacted. So very tight in that space. It's just a little fibre there that if I can just grab it.
Dr. Jana switches to another method to try and grasp the cotton wool.
You got these ones.
Oh, yeah.
Better.
This one's might be a bit better.
So you got that kind of grabby little thing on the end as well.
I'm using the forceps to clamp onto one of those fibres and hope that this cotton wool has got enough strength in it that it'll just pull the whole thing out.
Hey.
Got it.
Success. Look at that.
Oh my God, it's so big.
I think this will be making it worse for sure. But now I just need to have a look in your ear and just make sure.
With the cotton wool out, Dr. Jana can finally see what's wrong with Irina's ear.
The eardrum looks normal.
Yeah.
There's no perforation, no infection. Okay, all good. Yeah, it all looks fine, yeah.
With no ear infection found, the likely culprit for Irina's pain is her recent dental surgery.
I thought this could happen only with small kids, but you know? With adults also could happen, so yeah.
Retrieving things from stuck places is one of the things that emergency doctors love doing. And often it's the simplest things that give us the most satisfaction at work, because your patient is instantly relieved and there's nothing more to do and they can go home.
All right, just look after you. Don't be poking any cotton wool in your ears.
Thank you so much.
All right, no worries. See ya.
I'm just going to gently cut your bandage off.
36-year-old Tristan's right hand was crushed when a 200-kilogram steel pole fell on him.
This is broken and sort of snapped in half and displaced.
It was a devastating blow for the construction worker who relies on his hands to earn a living.
Sit. Good girl.
It's been 4 months since the shocking accident, and Tristan is still recovering.
The falling steel member essentially crushed my thumb and had severed 2 of the 3 main nerves. I had surgery to fuse the bone back together and reattach the nerves. The surgeons at the Royal Melbourne have been absolutely fantastic, and what they've achieved has been wonderful. I don't have full mobility of my thumb as of yet, so I'm still not back at work, but I still have it and I can move it from the base, so that's a huge help.
Good girl. Good girl.
Tristan's hoping it won't be too long before his life's back to normal.
Road ahead is looking fairly positive. Just need a small further surgery to regain as much mobility as possible, and then it's straight back into the workforce. Just being me again would be good.
What's this?
35-year-old Lee was choppered in from country Victoria in excruciating pain after crashing his restored 1992 Ford Falcon on its first test drive.
X-ray. That is very significant.
Lee's femur was badly shattered, but a CT scan cleared him of any life-threatening injuries. 5 months later, after surgery and rehab, Lee still has a way to go.
My leg is not 100% anymore, but I'm really impressed the way the surgery went, because they put a rod into my leg and it's a lot stronger than my old leg. So yeah, it came out pretty well. I've just got to learn how to walk again.
Despite his beloved Falcon being a write-off, Lee's just happy he's got a future to look forward to.
At the end of the day, no one was hurt except for me, and a car can be replaced. So I'm just grateful that everything's panned out the way it has. And yeah, like I'm on the road to recovery.
Oh, shit.
60-year-old Vlas came into emergency in severe pain after falling 4 metres off a roof and badly breaking his left wrist.
Just gonna gently pull.
CT scans revealed a terrible fracture in his back that had the potential to leave him paralysed.
This is about as bad a spinal fracture as I've ever seen.
Thankfully, Vlas didn't need surgery. He had a brace fitted and went home to recuperate.
Fantastic.
4.5 months later, Vlas's broken bones have healed, and he's grateful for the support he's received from wife Maria, daughter Stacey, and son Arthur.
Well, here's the good health. Cheers. Cheers, guys.
I just keep coming back to how lucky I am that I wasn't crippled. I didn't end up dying. It just defied the odds. I'm normally not supposed to come out of it this easy.
I'm just glad you're here and you're with us.
The care I got at Royal Melbourne Hospital was unbelievable. For myself now, I just keep working, stay active and appreciate every day.